Thank you so much. So good to be here today and hopefully share some thoughts and ideas. I say this every time I do a webinar, but it is much more interesting if y'all would put questions in the Q&A. I think we can learn. Obviously, you all can learn from each other, and I'll do my best to answer those from a pro-dependent perspective, which, again, like Scott says, is so exciting. It's growing and it's catching on, and there's a lot of exciting things happening with Prodependence. And so glad you found us here. So Scott will let me know when there is a question, and he'll interrupt me and we'll go from there. Like he said, I've been working with addiction and betrayal trauma for a long time. But for years, as many of you might already know, a lot of the treatment was focused around, at least with the betrayed partners and family members, around codependency. And codependency has, the flavor of codependency is that there must be something wrong with you, that you chose somebody who is an addict, or that you're in a relationship with someone who's an addict, or that your child became an addict, or that you've become ill as well because of that addiction. Prodependence takes a completely different stance on partners and loved ones, more that you are in a relationship with someone and in a crisis not of your own making. And so life becomes pretty chaotic, and oftentimes attempts to help our loved ones turn into, and we may do that in healthy or unhealthy ways, but Prodependence states that it's not your fault and you're not sick because you're in a relationship. It states you're trying to help somebody failing. And because we are built for attachment and connection, it creates a crisis in our life when somebody that we are attached to or love or connected to starts to fail in some way. In this case with addiction, but with chronic mental illness or many other things. So we're going to talk about healthy ways to help people that we love, and healthy ways to help yourself when you are in that particular situation. So that's kind of the introduction and the crux of codependency. Prodependence is really a totally different lens to look through, and I'm so excited about it. And it's a much kinder, non-disease model. It's more of an attachment model, which what we know is a lot of our struggles in life come from attachment disruptions. And I know you listen in on Matt's, he's going to talk a lot. He is highly trained with attachment, and he's going to talk a lot about attachment too on the second and fourth Fridays. So tune in on all Fridays, and you'll get a piece of that. So I don't know if we don't have any questions. I kind of had a topic I wanted to talk about, since we talked about, or just mentioned codependency. Back in the day when codependency, and maybe sometimes still, was a treatment model that people used to try and heal when they were in these relationships, they were told they also had an addiction. Their addiction was to the person who had the addiction. So I'm not an alcoholic, but I'm addicted to the alcoholic or to the sex addict or whatever, which is just simply not true. We don't get addicted to people. We may have compulsive behaviors related to behaviors around trying to help or manage the crisis. That doesn't mean that I myself, if I'm a partner, a loved one, are an addict. Now, if I have a co-occurring addiction, for sure, I want to get treatment with that, but being in a relationship alone doesn't make you an addict. So back in the day, we used to talk about, like an addiction, bottom line behaviors, or something I've heard, basically the behaviors that make me not sober. But if I'm not an addict, that's not relevant. That wouldn't fit if I'm not an addict. So from Prodependence, we talk about, as opposed to bottom line behaviors or non-sober behaviors, we talk about safety-seeking behaviors. So when a loved one or a partner are engaging in behaviors trying to help or fix or manage or assist or teach or whatever it is, save somebody they love who is struggling, they may engage in behaviors that aren't helpful, but they're scrambling to try and figure out, what can I do? So we call those safety seeking, because truly, most often, that's the way that the partner or family is trying to keep themselves, or maybe even the addict, safe. They're trying to create safety, predictability in their world that's just been turned upside down. So from what I'll talk about today, these aren't necessarily healthy or unhealthy. These are just typical behaviors that I have to judge for myself. Is this healthy for me or not, doing some of these? So I'll give you some examples, and please pipe in if you have questions or comments about these, and we can kind of discuss that as well. So I'm just going to throw out ideas, so maybe these will be helpful. If I'm a partner, for instance, of somebody who has an active sex addiction, I act out sexually and I lie or I deceive the partner about it, the partner might start doing all sorts of things to try and create safety for him or herself. They might start digging through phone records. They might start looking through credit card receipts. They might go check, see if the car has been driven and if the engine's still hot. They might go through bank accounts. They might look through emails. They might look through computer histories. They might hire a private investigator. They might start calling the boss and asking where he or she was that day, if they were lying about their lunch appointments. Or and in the past, like I said, we used to call that slips, that you weren't sober. I tend to think, and we tend to think, that those behaviors in my efforts to be safe may or may not be healthy. Looking through a computer history might be something I need to do to create safety in my home for some people. However, for other people, I might do that and it gets sort of obsessive and it makes me feel worse, not better. And I stop just looking for need to look for, or whatever helps create safety, and it starts to take on a life of its own, and it creates an imbalance if I'm the partner. So most of these are up to be interpreted by the person who is engaging in these safety seeking behaviors. Do they create safety, or do they create more chaos? Are they healthy for me, or are they unhealthy for me and or the relationship? So instead of calling unhealthy, we just talk them in the sense of really picking them apart and saying, what kind of things do I need to do to feel safe, and what kind of things do I need to know? And sometimes I can do that with the addict, and a good therapist. We can talk about those. This is where boundaries might come in, where I might need to say, there's a few things that I need to be able to do in order to feel safe and be able to stay in this relationship. And I'm talking about sex addiction, but this could be drug addiction, alcohol, it could be anything. I just come from this model a lot, so it comes very easily to me. So we need to look at those individually. Is looking through the computer history something that creates safety and peace of mind, or does it create more chaos? Then I need to decide, is that healthy for me or not? Is checking the calendar, knowing where somebody is, or asking questions about somebody's whereabouts, is that safety for me? Does that provide safety, or does it provide chaos and stress, and does it make life harder? So those are some ideas. So if you have some in your life will tell you that those are unhealthy behaviors, I would challenge that. I would say they could be unhealthy, but they might not be. They might be what I need. And I might not need those behaviors forever. Sometimes addicts get better and trust is built, and I might not need to engage in those behaviors in the future, but I might need them right now. I would say things like that I do need, be as open and transparent as you can with your support system, with a good therapist. Hopefully you'll have one or find one. And maybe even the addict, if it's appropriate, because they can help you kind of decide for you if those are healthy or not. Because sometimes in the chaos, it's hard to know when my head is all over the place, and it's hard to figure out what's right and what's wrong for me. So I don't know if there's any thought or any feedback on that, but that's something that was today and thought would be good to share.
Yeah, thank you, Kim. Remind everybody, just use the Q&A feature to ask questions. I wanted to kind of piggyback a little on what you were talking about. I always call those Sherlocking behaviors, where you just, the betrayed partner desperately needs the truth. And one of the, we always encourage, and I'm a sex addict, so I'll speak from the addict's perspective. Addicts in a relationship who want to save that relationship need to rebuild trust. So we always encourage addicts to help by being open and honest so that the betrayed partner doesn't have to sneak around and Sherlock. We ask our addicts to put it, if your wife or husband or whoever wants a tracker on your phone, put it on your phone. If your partner wants to control the finances completely, turn it over to your partner. If your partner needs you to check in, while you're away on business once an hour, on the hour, do it. Because that is, not only is it helping your partner, the betrayed partner feel safe, it's helping to rebuild relationship trust. So I like what Kim said about bringing the addict into the conversation about what's reasonable, what's not reasonable, because it can get a little out of hand. And that's when we get into what people refer to as codependent and all that kind of stuff. And we don't like that language, but there's nothing wrong with you because you need to feel safe. As an addict, I can say there's nothing wrong with my partner who needs to feel safe. I'm the one who caused my partner to feel unsafe. I need to work to rebuild trust.
Right. So. Thank you. The key is we don't want to necessarily, we want to do the healthiest thing for us and for the relationship. So yeah, it would be ideal if it could be a couples, a partner, we could talk, we could open that conversation and say, here are my needs. Here's some of the things that I need to know in order to rebuild safety between the two of us. And they might, and oftentimes don't make a lot of sense to the addict. I've seen addicts bristle at a lot of, those, because if I've been doing addiction for a long time, I'm used to going unchecked, and it's not comfortable. It won't feel comfortable, it'll feel controlling. And it might be, again, that's why the conversation, having some support around that conversation is super important. I think the idea that I am a sick or compulsive or addicted person because I have the need for safety is what's incorrect. That's incorrect thinking. I am in a state of trauma because of the betrayal, and I, like Scott said, am desperately seeking truth in order to create safety. And that's why I call them safety seeking. I like Sherlock, that's pretty good. So those safety seeking behaviors are exactly what they are. We just want to make sure that they're healthy, that they are healthy for you, that they don't just create more chaos for you. Then I might have to recalibrate those and reconsider what it is that I'm doing.
Yeah, we got just a comment here in the chat feature, but I think it's worth sharing here. I brought safeguards. Oops, sorry, I tapped myself. My cat tapped me away from the screen. There we are. I brought safeguards like blocking apps and putting parental controls in place to avoid temptation and help me feel better, i.e. safe. But he did not respond well to that. I have yet to circle back to that conversation because I am unsure where to start if we have that difference of opinion. Any thoughts on that, Kim?
Yeah, thank you for sharing that. I think I just mentioned, it's often not received well, especially in the early stages of kind of learning about the addiction and the addict getting help and getting healthy. Oftentimes it will feel controlling and it will lie, and I told you the truth, and what else do you need to know? But obviously it takes time, consistent behavior over time to build trust. I think those conversations are very, very worth having, particularly if they're important to you. if that's an important safety thing for you, I need to know there are at least some checks and balances on internet usage, maybe particularly in my home. And you might even be able to say to the addict, I don't know what that looks like. I'd like you to take that to your therapist or to your group and figure something out and let me know. Because I don't really want to police the internet. I really don't want to be the net nanny, so to speak. That would even be a better conversation because it takes that pressure off of the partner to feel like I have to manage and sort out what's going on with the addict. And that's going to be a long-term game plan for the addict is, learning how to manage their addiction, manage how to keep themselves safe and out of addictive behavior. So those are kind of my thoughts about that. I mean, obviously it's up to you how important that is to you, that conversation. But I always say when we kind of have these hard conversations or set boundaries, rarely are we going to be thanked for them. No one's going to be like, wow, thank you. I wouldn't know I was out of line if it wasn't for you. Most of the time you're going to get, what do you mean? What do you mean? I'm a grown person. I can do it myself. I told you this and that. What else do you need to know? So you're going to get a little bit of that. I would say just stand in the wind and be firm about what it is you need. And don't give up on that conversation. If it can't do it right then and it gets too elevated, come back to it later. Get somebody else in there to help you. This is in large part what we do in therapy with couples. Sometimes as a therapist, I create a little bit of a buffer between the couple. So when these hot topics happen and we need to discuss boundaries around certain things or talk about difficult things, it can create a little bit of a buffer and create a situation where we could have a healthier conversation, a more productive conversation. And I can kind of, play middle. I can play middle and, try and help the other see the other's point of view. That's part of the blessing of therapy. So
yeah, I'll tack on the addicts end of that again. At our Seeking Integrity Treatment Center in Los Angeles, we work with sex addicts. And one of the very first things we do is install Net Nanny on their phone. We make them do it. I actually think Net Nanny is a good tool for the addict, and it's a good tool for the betrayed partner. Net Nanny, Covenant Eyes, Web Watcher, those are the good ones. It totally makes sense. And I think maybe when you revisit the conversation, you say, I need this to feel safe. Your husband or partner may understand a little bit more. But I don't know where he is in his recovery and if you have couples counseling and things like that, where you can work through that.
Thank you. Sometimes I make the assumption, and you'll hear me, I try and qualify that and say, if we're at a certain place in our recovery, or if you have a good therapist, or if you have a good support system, all of those things are so important in healing from addiction, any addiction, and for being in the crisis and the kind of the crisis as the family member or partner, having guides to help navigate that is invaluable and such an important part of figuring out how to navigate those crazy rough waters, because it can get kind of crazy. But yeah, most addicts, when they have a little bit of recovery, realize, well, I traditionally haven't governed myself very well on the internet, for instance, or driving home from work this way, or whatever my battle is. So I probably need to start working on creating safety for myself. That's ultimately what we're going for. If I'm a recovering addict, I got to start figuring that out. But for the partner, there may be some things that don't make sense to him or her. That's okay. It doesn't have to make sense. If it's what you need, it's what you need. Keep talking about it.
Yeah. In the Q&A here, says, piggybacking on that, one of the biggest aha moments brought up by my therapist was that I should feel free to check my partner's phone. And why wasn't I doing that? And then it says, because I was scared for a lot of reasons, he's pulling away, etc. Do you see that a lot, that fear of knowing the truth?
Oh, yes. I think that's a very common feeling for a partner. Some of it is want to see. I don't know if I want, I always say partners kind of, if they're not, for instance, for sex addiction, again, I might not be a sex addict, and I don't want my own library of all of my, my partner's acting out behaviors. So part of it is that, part of it is just frightening. What does that look like? What am I going to have to do? What if I find something? And depending on where the addict is, how's that going to play out? So I would say be true to you. A lot of people, like I said, traditionally they used to say, if you check the phone, you're sick, you're acting out, you've just had a slip in your sobriety. That's old codependent language. I don't believe that at all. I believe if that has been a source of lack of safety in the relationship, then that may be something that I might need for a time until I do feel safe and secure again. And safety language, like Scott said, is really important. And they might not, your partner may not hear that when you say, I don't feel safe, and you may need to be specific. I don't feel emotionally safe, sexually safe. I don't feel safe, with, like, I live with somebody who is being honest and true and transparent. You may have to use that kind of language. That's unsafe. That means I'm living in your lie. And that feels terrible. I don't want that. I want to live in truth. And if you can't give it to me yet, or you're struggling to do that, then we got to find ways to create transparency, because I can't live with the unknown, because the unknown has hurt me in the past.
Kim, before we go to the next question, can you talk a little bit about formal therapeutic disclosure and, sort of the pitfalls and, more importantly, the benefits of that, and kind of how that can, if somebody's really out of control, Sherlocking, what does disclosure do for that?
Yes, I'd be happy to do that. Disclosure and full disclosure is a really, really important part of a individual and couple's healing, and for an addict's recovery. Formal disclosure there's all sorts of ways to disclose, and a lot of people have received different types of disclosures, like partial disclosures, drive-by disclosures, disclosures like, what do they call those? Like, over time, I get a little...
Death by paper cut.
Death by paper cut, exactly.
Yeah.
Those are all forms of disclosure, and they usually are very painful for the partner. So the best thing that you can do is get a professional involved that can help with a formal disclosure. We do this all the time, and that means that the addict prepares a full and complete report of all behavior surrounding their addiction, whatever that is, whether it's alcohol, whether it's drugs, whether it's sex. And likewise, the partner is working with a professional who is trained to help he or she prepare to receive a full disclosure. There's some caveats to disclosure that are really important. Oftentimes, partners want disclosure like now. I want it yesterday, of course, because I won't feel safe until I know the entire truth. However, that doesn't always happen. We try and do it as quickly as possible, but it's really up to the addict, their level of contrition, their level of readiness, to be honest, because obviously they can lie in a disclosure. So we want them to be far enough along that they are fully willing to be transparent and honest and completely honest about everything. And we also want the partner to, like, he or she can receive that I have enough emotional stability, that I have enough support, that I have enough places to turn, that I can receive that without it causing lots and lots more damage, without any place to go with that. So early on, the earlier the better, but definitely not, we don't want to do it prematurely, or it can be incomplete, and that will cause a lot of additional damage. So even if you have to wait a little longer than you want in order for him or her to get their disclosure right, it's worth the wait. So it doesn't come out in, like you said, death by 1,000 cuts. We don't want that. We want to clean the street so we can start okay, we're on the same page. I know everything. There are no secrets between us. Now we have the possibility of healing, reattaching, connection. And also for a lot of partners and loved ones, they can make really important decisions for their own life once they have the whole truth. When I don't know everything, how am I supposed to be able to know, can I tolerate this relationship? Can I stick it out? I don't know until I have the whole truth. So those are some important, and please, with disclosures, if you have good professionals that are trained, specifically trained to do this, that's the best possible outcomes. I do disclosures very frequently, and I work with either the addict or the partner, and the partner addict has their own therapist. They each have their own therapist, and then the therapist and the two come together to do the disclosure. I've even had therapists from other offices that work with, and they come into my office, I go into their office, and we usually about a 2-hour session, and there's all sorts of preparation for that. And it's painful, but it ends up usually being the real start of reattachment in the relationship.
I know a lot of therapists will have the addict take a polygraph after the full disclosure so that the betrayed partner knows, yes, this really is it, or this is it to the best of my partner's ability to remember. Do you do that? Do you recommend that?
I am a pro polygraph person. I know not everybody feels that way. And I've kind of developed into that over the last 20 years. Early on, I was like, well, I don't know. But I find that it's good for both the partner and the addict. The addict rarely knows how good it is for him or her. They're usually like, whatever they want, I'll just do it. Or they're scared to death, right? Which I understand. Polygraphs are frightening if you've never done one before. But that is the standard thing that I typically do, is plan the polygraph within a week of the disclosure, after the disclosure, to confirm the truthfulness of the disclosure. And then if there were any discrepancies, the polygrapher should be very experienced in this type of work, not just any polygrapher. And there are those out there that work with infidelity and drug use, and they specifically know what to ask and how to do the interview. And just for common knowledge for some of you who maybe haven't been through that, polygraphs, it's usually a very long interview with the polygrapher. The polygrapher asks tons of questions, and they're very, very thorough. If it's a sexual history, they know exactly what to ask, or anything else. And then the polygraph itself is usually only 3 or 4 questions. The more questions, the less valid the polygraph. And those questions confirm the truthfulness of the interview. And then all of that information comes to me as the clinician, if I'm the one treating the person getting the polygraph, and I interpret all that, and I've set in on the disclosures, so I've listened and I know what all that is. And if it all matches and there's nothing new, I will call the therapist who treats the partner and give him or her that information so that they can give that information to their client. And then if it's depending on the couple, most will volunteer to do what we call maintenance polygraphs ever so often. But what most addicts don't realize is how good that ends up being for their recovery. It's another check and balance for them. Oh, I've got a maintenance polygraph in 6 months. It's just kind of another thing that can help keep them out of their behaviors and motivated to stay in recovery.
Yeah, it's a level of accountability that the addict can't cheat. You can't cheat it in your disclosure. If you know you're going to take a polygraph after disclosure, you have to get everything in there because you don't want to fail the polygraph. And you need to stay in recovery, and it forces you to be honest, as you go, because there's a polygraph coming in 6 months, and if I've got a lie or a secret, it's coming out. My partner will know. It's better to tell now.
And I have had that happen. I've had a polygraph come back with a response, meaning they weren't truthful on a question. And I've sat down with that person and said, so here's the area that it shows you were untruthful. Would you like to tell me what it is that you held back or that you didn't tell? And I've never had anybody not say, okay, I left out this affair partner. I left out this particular thing. And then that becomes clinical. You know, we talk about that, and then we also disseminate information to the partner so that he or she can truth. The point is to get the truth out. That is one great tool. So I am pro polygraph.
Me too. Yay. I can't stop myself from desperately trying to piece the puzzle of my husband's deceit together, despite my therapist telling me that it's bad for me. Interesting. Each new revelation heightens my anxiety. Oh, we're getting death by paper cut. I stop eating, sleeping, etc. I know it's bad for me, but I feel like I need to know everything so I'm able to make an informed decision about whether I'm willing and or able to forgive him and stay in the relationship. He continues to withhold information out of fear that I will leave. Yes, that is the most common reason. How can I convince him to do one complete disclosure so that I can avoid the constant cycles of trauma and be equipped to make an informed decision? There we go. How do you convince the addict to do a disclosure?
Oh boy, we are on the same wavelength, it sounds like. You can't force an addict to do a disclosure. I would question, this just gently would question anybody's feedback that you don't need all the truth. I think if you're prepared for it and you are getting, you know, what am I trying to say? Information's coming out randomly and not in any sort of organized fashion, and which indicates that he's still, or in this case, maybe he is still withholding information. I absolutely would question anybody's opinion that you shouldn't be asking those questions. I don't think relationships can be fully, healthily, and securely attached without 100% transparency. So it's not blessing his life or her, it's not blessing your life to not ask the questions. I think I would absolutely, when I'm ready and with the help of a professional, if that's a boundary for me, then I would find a way to state it that way. In order for me to feel safe in the relationship and to continue to work on this together, I need a full and complete disclosure followed by a polygraph, because I'm tired of getting bits and pieces. Obviously, you're still not being forthcoming, and I can't live like that. That's torture for anybody. It really is. So if your therapist doesn't support you in that, or maybe you can ask him or her, this is what I need, help me, support me here. I do need the whole truth. And I think not having the truth is more torture than having the truth. Even though getting the truth isn't easy, it's the what ifs are way worse for most people long term.
And ultimately for the addict, giving the truth is the much easier path than continuing to lie and keep secrets. But try explaining that to an addict who's lying and keeping secrets. Not so easy.
But be gentle with yourself too, because this isn't easy to navigate, and I want to make sure I say that it's not easy to navigate, and it takes time to build for the partner to build their confidence in understanding what it is they need, because this is a crisis. This is an active, ongoing crisis, and the addict will not fully get healthy and recover in the way he or she needs to without getting completely honest. Period. It just won't happen. We know that by research and years and years and years of, going through this. So be also gentle with yourself if you're not ready to set that boundary, and have some sort of outlying consequence, meaning if you don't do this, then the result might be this. I might not be able to stay in this relationship because I can't live in a lie, or I'm going to need to take some time off, or whatever that might be. Be patient and gentle with yourself until you're ready to do that. But I definitely would push for truth no matter how uncomfortable. So
yeah, I 100% agree. Since the disclosure, my husband has become a shell. He's crippled by guilt and self-doubt. He's not sure he can be faithful or monogamous and is terrified of hurting me in the future. I find myself wanting to rush his treatment so that I can find healing, which I know can't work. That process can't work. healing can. I've tied my healing to his healing because of my impatience. How can I move on and find healing if he is stuck?
Yeah, that's really hard. That's kind of a hard situation. Um, it sounds like, and I don't know where he is in his recovery and where how he's working. If you guys had a full disclosure, it is a bit traumatic to go through all that, even for the addicts. Sometimes they have compartmentalized some of their behavior, so they don't have to deal with the full effect, the full emotion that surrounds all of that. So seeing it all out laid to bear can be overwhelming. I think this is another one of those pieces, if he was willing to be honest, however, that's really great that he was willing to do the disclosure. This might be another one where he just he has to do his work and figure out how to get out of his shame, how to get out of his self-doubt. Maybe maintenance polygraphs would be really good in that case, because he can say, look, I do, and most addicts don't trust themselves. They realize I can't trust myself. Look at the aftermath of what I've done. And that's also part of the healing journey for them, is learning how to trust themselves, but not on their own, with the help of others and with accounting and with all of that. And then maybe a follow-up, maybe a maintenance polygraph will help. Like, I can't trust myself every day, but I can get through these 3 months and follow that up, and not try and eat the elephant in a day, as they say. In the meantime, while you kind of see him grapple with his shame and guilt, is what I'm hearing, stay balanced, stay your course, stay your course. I wish it was a magic. There was some sort of magic to this, but it is time and consistency, and accountability that creates healing for him. And whether or not you can ride that with him, ride that out with him, is your choice. But you can always show empathy if you feel like you can. I'm sorry you feel that way, and encourage him towards his work. But stay the course and keep taking care of you. Keep having good places to go for you to kind of pour your soul out where it's safe, and places that can support you if he can't.
Yeah, you can't heal him any more than he can heal you. His healing is his and yours is yours. So yes, stay on your course. And just again, from the addict perspective, his response is not unusual. A lot of guys, we see them enter our treatment center, or we see them right after disclosure, and they're a mess. I mean, they're just a mess, because that's the first time they've ever said out loud the disaster that they've created. They've this is what I did, this is, and they see the pain, particularly after disclosure, in the betrayed partner's eyes and responses, and it can be crippling for someone, particularly if they truly love their betrayed partner. And it takes time and it takes work, and he is going to need support from other recovering addicts. That's where he's going to get well from his shame and guilt. Well, it sounds like you're supporting him as best you can, but and I applaud you for that. But he has to do his work, definitely.
That's right. And everybody's path on that's different. The fact that he feels that deep remorse, to me, tells me he has a heart, he has empathy, he understands. So the possibility of healing is there if he can manage that. But that is his to manage.
And Kim, might he be dealing with some, unresolved early life trauma that's cropping up, things like that? I mean, there could be a lot going on here.
It could also be a mood disorder. Oftentimes, addicts, as they start in the healing process, they realize that they may have some underlying depression, anxiety, other things that could exacerbate some of their behaviors, the self-medicating. So I would be sure that he has people looking at all those angles. If he feels like it's a slump he can't get out of, his mood just will not he can't find joy or peace or happiness, even, you know, little glimmers of it here and there, then there may be something deeper going on.
Yeah, and medications can help with things like depression, especially in conjunction with therapy. So there's a lot.
100%. And sometimes addicts will resist that. They'll just say, well, I'm just, you know, I'm just done all these naughty things, you know, which may be true, but kind of self-medicating, whether it's alcohol, drugs, sex, it doesn't matter. They are putting chemicals, or at least a chemical response in their brain that may be one of their coping mechanisms for an underlying mood disorder or something else. But a professional, you know, would really need to look at that. Psychiatrist, psychologist, a therapist.
Yeah,
You can hear me
but
here.
his response is definitely not unusual. Kim, I have a question that I wanted to ask for me. I have somebody in my life right now who is just living in my head. I mean, just living. You know, if I have 10 seconds of downtime, I'm thinking about this person, and not kind thoughts, but it was suggested to me that I go to Al-Anon or Coda. So last night I went to a Coda meeting, and a lot of what was said there I found really useful, and a lot of what was said there I found really blaming and shaming. And you know, this is a situation where it's the other person's behavior. It is not me. It's the other person's behavior, and it's become so egregious that this individual is living in my head, and I can't get out of the relationship. There's a reason that I can't get out of it. So I went to Coda. How can, I mean, we talked just a couple days ago about, you know, there's a need for Prodependence 12-step groups rather than Coda. But in the interim, do you think people can find help in Coda and try to apply Prodependence principles? How does that work, or does it not work?
That's the $1,000,000 question today. Thank you so much for bringing it up. I grew up in the 12-step world from the age of 18, 19. And there was so much good. I got so much good from the community that it provided, and the support, and just the place to go to barf up sometimes some of what was going on in my head, what was living in my head, like you say, or who may was living in my head. But so there's a lot of good, and then I do think, like you, there's some things that aren't useful, especially the part where it wants to make an addict out of somebody who loves somebody. I just think that is fundamentally flawed. It's just not true. So I do think there's a place for 12 steps, but I think if you attend support groups like that, you're going to have to be brave enough to say, maybe to a sponsor or even to the group, you know, I love it here and I've learned so much, but I just want you to know I don't see myself as an addict. I see myself as somebody who's dealing with a crisis that I didn't create, in a relationship that I can't get out of. So I really need help just, you know, taking with my own self-care, with my own, you know, any ideas you have that would help me clear my brain, you know, help me help calm down some of the trauma responses that I have when things happen. And if they can't do that, you may have to find another group, another sponsor. But I say this is going to be a lot of educating sponsors and groups and support systems and communities about who you are. And you can state, I am not in denial about my life. I live in it every day. And I'm okay admitting that I may have safety-seeking, unhealthy behaviors. I need to check in, but I don't have the addiction. I'm not the one who is compulsively using heroin or pornography or whatever it is. I'm just living with somebody that I love that does that. And that makes my life feel crazy and out of control. So I don't know if that's an answer to a question, but I feel like we just have to educate the people who support us and ask them, can you support me here, from the perspective you come from?
Yeah, and yeah, the idea that I'm engaging in safety-seeking behaviors, and you know, I mean, this person is taking up space in my life that is not deserved, and to the point where I'm not able to enjoy my life. And I'm very aware, I mean, I've been in recovery for 20 years. I'm very aware of what goes on in my head and that I'm not always sane, but you know, I'm pretty clear on this one, and I've done a lot of journaling. It's not me.
Right.
But I don't know how to deal with it. So yeah, and you know, I know a lot about Prodependence. I helped write the book. I mean, and it's still really, really hard to.
I think you breathe. I think that makes it, I mean, I think you're saying what probably most people feel in those similar situations. You can apply anything, and it is still so painful to not be able to control or manage somebody that you care about, and manage your worry and your fear and your doubt and your disappointment and your anger, whatever it is. I also want to say that if I feel like sometimes when things happen, it is traumatic, and trauma responses are repetitive. Sometimes if I can't push things out of my brain, I may be having a trauma response that would require professional help. There are some amazing modalities. EMDR is one of those that can really help with obsessive, like kind of trauma-based thought processes that can help push that through. There's other therapies, but so sometimes we try to stop it on our own and it doesn't work. So don't be that professional help if anyone's dealing with that, because it could be more than just me being worried. It could be running a little deeper for me if it's disrupting my sleep, my, and it can also sometimes go to mood disorders for a partner or family members or friends. So we want to make sure that I'm checking all those boxes. I'm making sure that it might be more than just me being worried.
Yeah, I thank you for bringing up trauma response, because that had not. I mean, I knew that, but I hadn't attached it to this situation. I mean, this individual is a repeat of my narcissistic, overbearing, abusive mother. And I may be reacting to my mother as much as this individual, and that may be, it's just, this is the person that's in my head right now.
Right. Well, and I love Dr. Rob says all the time, we don't really heal our traumas, we manage them. And what's interesting in my life too is things come up, like things that are reminiscent of traumas that I have dealt with, worked through, done a lot of therapy about. All of a sudden I'm like, whoa, why am I responding like this? And remember, when I'm in a trauma response, I'm in the part of my brain that is the reactionary part of my brain. It's the limbic system. It's the part that, tells my lungs to breathe and my eyes to blink. It's not voluntary, it's involuntary. So when I am responding in that part of my brain, I'm not thinking, wow, this might be like A, B, and C. I'm just reacting. That's how we know that it's trauma, especially when I feel like I just can't problem solve it and it's really disruptive. So yeah, there's probably, and that happens so easily when you are support or a friend or a loved one of somebody who may be self-destructive or other destructive. And it's super painful because all our efforts sometimes to attach and to connect, it's like playing in the snake pit. We just keep getting bit. And it's like, dang. So making sure that we're doing everything to take care of ourselves and, putting ourselves on that list is super important.
Yeah. We have another question here. Let's go to this one. My husband and I both see a therapist, and we have a couples therapist, but there are no CSATs within 300 miles of where I live. Sorry to hear that. We are working with my insurance to find a CSAT, but it's taking a long time. I have an issue that none of our therapists knows how to deal with. My husband has 77 days of sobriety. I have a unique situation because I fit my husband's erotic template. That's actually not that unique. He would include me in his fantasies. His affair partner looked like me, and he looked at porn with women that looked like me. He's taking an antidepressant, which has reduced his sex drive, which is very common, making it so we can cuddle without him getting worked up. After 35 days of abstinence, we decided to fool around. It went well for a couple of weeks. We focused on being mindful and present, but it started to put my husband in an addictive state. We have returned to being abstinent, but I am so frustrated. How long should we be abstinent? How will we know when he is healthy enough to move forward sexually? That is a humongous question in terms of the meat packed into it. All you, Kim.
That is a tremendously important question for you. And well, thank you for asking it. The first thing I thought was, one thing I tell partners a lot, even though his arousal template is set for, you know, some of the behavior with you as the partner, this is still really his job. This is his work, right? He has to be super aware of when he is present in the relationship, meaning I'm having an intimate connection, not just sexually, but in any way. But in this case, you brought up sexual behavior. If I am being intimate, that I am present, that I'm aware. Sometimes sex therapists can help with this too, but only if they understand addiction. And there aren't a lot of those, I will just say. There's some, but not a ton. To do sexual practices that create intimacy, that create connection, that avoid intensity. Remember, addicts will mistake intensity for intimacy. So if the sex gets intense, I think, oh my gosh, I've never felt closer. We were so in love. And it's like, no, it was just really intense. We just amped up the behavior to make it super intense. That is one of the thinking flaws in an addict, is intensity equals intimacy. So one of the things that I'm thinking is maybe sexual practices that are more sensate focused, which means we're super, like, lights are on, eye to eye contact. We're being very aware of each other. And if one starts to dissociate, if he starts to, because he would have to dissociate in order to be acting out while being sexual, his mind would have to wander somewhere else. And if he starts to do that, there's some type of a signal that he can give. So we stop sexual behavior and go right to intimate behavior. So there is ways to work with this. I guess I want to say there's hope to that. The second side of that is, I will tell partners frequently, the addict's mind is a messy place. There's a lot of stuff going on in there, whether they're being sexual with you or they're being sexual, on their own or whatever they're doing. For a partner, sometimes staying just out of their brain, staying out of their head and focusing in on your own body and what your body's telling you, the senses you're experiencing. Do I feel safe? Do I feel unsafe? And let him sort out, am I here? Am I not? Am I fantasizing? Am I present? Because it can be really easy for a partner to just focus so solely on the addict that I forget, oh, my body's here too. Like, I'm here. My pleasure matters. My connection matters. So I'll tell partners, if you can manage that, stay in your own truth, stay in your own head, stay as present as you can, and let the addict learn how to deal with that. And if he or she starts to dissociate, they need to find tools to come back and refocus and be present. And the more intimate, connected, nurturing behaviors you can do that are non-sexual, the more that will benefit the sex life, the actual sexual behavior between the two of you. So I hear your frustration, and sorry for what you've been through, because that is really, really painful. But there is a way out. And it sounds like you guys are working really diligently on it. I can't tell you how long to be abstinent. I think abstinence is really, for you, it would be for safety, and for him, it would be to recalibrate, like, do I need sex? Will I survive without it? Am I okay? Figuring out how to re-enter healthy sexuality with you. So there's hope. Hold on.
Yeah.
Stick with it.
He's got 77 days of sobriety. That is very early recovery. If he can be present with you at all, he's actually doing really well. I would encourage you to sit down on the Wednesday 5 o'clock Pacific group with Dr. David Fawcett. David talks about the brain resetting and recalibrating and how long that takes, and what needs to happen for that to take place, and that'd be a good question to ask David. And then also talking during sex, having a conversation during sex.
Yes.
It's hard to drift off when you're talking to each other.
Also, I think part of that question was I'm having a hard time finding a qualified therapist near me. Sex and relationship healing has some of the best drop-in groups. Matt does the couples attachment stuff every other Friday on second and fourth Fridays, the same time, same day. That's some great questions to bring to him as well. Those are some great free resources with very qualified and highly trained therapists who are giving their time. So I would just I know you found Sex and Healing or you wouldn't be here, but check out all the other groups too, because there are some very good ones there. Just drop in groups that maybe other people have experience like yours and can share what they've learned. That's always helpful.
It is 2:30, so we're out of time. Kim, thank you for your expertise. Everybody in attendance, thank you for being here. Thank you for your great questions. And Kim will be back in 2 weeks. Matt will be back next week, same bat time, same bat channel. I'm of a certain age, you can tell. So we'll see you with Kim in 2 weeks. We'll see you with Matt next week. Anything you want to say, Kim, to wrap us up?
Just thank you very much for showing up. Thank you so much for your questions. Please come back and bring your questions with you, and we'll keep learning together. And I will see you in 2 weeks. Bye-bye.
Thank you, everybody.